Hello, I'm Dr. Greg Winteregg. I'm a dentist and a partner at MGE. And this is the next in my series on the basics of selling dentistry. So today we're going to take on the number one stop-in barrier that you run into, and that is, I have no money. There's going to be some version of that, is this cost too much? I could never afford that. There's going to be some version of, I have no money. Now, if you watched the two previous videos, doctor, you know that you're the one that needs to have the money conversation with the patient. And we know that you now have to determine if I have no money is faulty or legitimate. So I'm just going to give you my advice. I don't like scripts, but you're going to have to, in order to get the patient to communicate with you, ask questions. And that is going to be the stable theme of this entire series. So when the patient says, I have no money, what I would like to say is, I understand this costs a little bit more than you were prepared to pay. Could you put that on a credit card? Now, doctor, I know that might give you a little bit of a nervous stomach, but it's what has to be done. If you really care about them and you really believe that they need this treatment, I will tell you over 50% of the time when you ask them if they can put it on a credit card, they will say, yes, I just don't want to. Okay, so now what do you do is the question. Well, number one thing you do is just tell them again. So what you have to do is just keep repeating the treatment plan. The rule is 3 times. And at some moment in there, they're going to tell you the real stop-in barrier. The real stop-in barrier 90% of the time is, I don't want a shot. My teeth are going to be sensitive afterwards. I talked to someone that said I shouldn't have a root canal done or whatever the procedure is. Now they're really in communication with you, and they're not just giving you some faulty explanation about money. And my advice is that you have at least 3 financing companies. Around MGE, we highly recommend Springstone. If you go to springstoneplan.com, you can get registered as a provider. And Care Credit, I think most everyone knows about them, and there's other companies. So have some financing available. But keep this in mind. Just keep asking questions until they give you the real stop-in barrier. It's usually not money. And that's my tip of the week.